Assalamualaikum, my name is ASHREZA. So today I will present about the ostomy care and about the one piece of ostomy bag. So first, maintaining proper hygiene of your ostomy is essential for ensuring your health, preventing infection, and also keeping the skin around the stomach is in good condition. So the step for effective care, first, keep the skin around the stomach is clean and dry. And why it is important? Because keeping the skin clean and dry can prevent the irritation, infection, and also can ensure that the ostomy pouch adheres securely to your skin. So how to do it? Use the warm water and a soft, non-abrasive cloth or gauze to gently clean the area around the stomach. Then avoid using harsh soaps, alcohol-based product, or anything with strong fragrance, as this can irritate the skin. Let the area dry thoroughly after cleaning. Ensure no moisture to remains, and this could impact the adhesion of the ostomy pouch. So second, inspect the skin regularly. Why it is important? Regular inspection can help in early detection of redness, rash, or other sign of irritation. Prompt action can prevent more severe complications like infection or pouch leakage. How to do it? After cleaning, take a moment to examine the skin around the stomach. Look for any redness, swelling, rash, or broken skin. If the patient notices anything unusual or persistent irritation, consult to the healthcare provider immediately. So third, wash your hands thoroughly before and after handling the ostomy system. So why it is important? Proper hand hygiene can reduce the risk of spreading of bacteria or germs, minimizing the change of infection. So how to do it? Wash your hand with a soap and water before touching the ostomy system. Scrub all areas, including between finger and other nails, for at least 20 seconds, and dry the hands with a clean towel or allow them to air dry. Repeat the same process after handling or changing the ostomy pouch. So one piece of ostomy bag, the durability of use. Most one-piece ostomy system are designed to be used for a period of 3 to 7 days. The exact duration depends on various factors such as stoma output. High output stoma may reduce the effective wear time. Skin condition. Healthy skin allow for a more secure fit, extending the lifespan of the system. And the third one is personal comfort. Users often change their system based on their comfort level. Frequent change are essential to minimize the risk of leak, odor, and skin of irritation. Second is cost of one-piece ostomy bag. One-piece ostomy bags are often less expensive upfront compared to their two-piece counterparts. However, because the entire system is replaced during each change, the overall cost may vary based on usage frequency. Despite this, they are considered budget-friendly due to the simplicity and fewer components. Third one is design of one-piece ostomy bag. The one-piece system feature are integrated pouch and skin barrier, combining both into a single unit. This streamlined design offer is of use for beginners and active users, a compact system that reduces the bulk of spare component. Fourth, skin protection. Because the entire system is replaced with each change, it may expose the skin frequent removal and reapplication, potentially leading to skin irritation from adhesive. Increased need for protection products such as skin prep wipes or barrier cream. Proper skincare and adhesive removal techniques are crucial to maintain the skin health. The next one is leak prevention. The fully integrated design of one-piece ostomy bag provide a secure and seamless fit, which reduce the potential for leaks. This simplicity ensure the consistency, especially for those predictable stoma outputs. And lastly, flexibility of one-piece system are known for their thin and flexible structure, making them an excellent choice for the active individual who require freedom of movement. Users who value the discreet and comfortable fit under clothing, while customization and adjustment may be limited compared to second piece system. The flexibility offer a practical solution for people leading an active lifestyle.
Assalamualaikum warahmatullahi wabarakatuh. My name is Seri NAJWA. My number matric 076986. Today I'm going to talk about the two-piece ostomy bag and its features. It's designed to make your care routine easier and more effective. The two-piece ostomy bag has two separate parts. First part, a skin barrier that protects your skin and stay in place longer. It reduces irritation. A pouch that collects a waste and can be detached when it needs to be emptied or replaced. Here is some key points about the two-piece ostomy bag. First, as skin protection, the barrier lasts longer, so it is gentle on your skin. Second, design the pouch connect to the barrier using the flange system, make it easy to replace. Third, cost. It can be more expensive since you buy the part separately. Fourth, flexibility is slightly less flexible due to the flange connection. Five, leak prevention. Properly securing the flange is important to avoid leaks. Lastly, durability. The flange lastly 2 to 7 days, while the bag can be changed more frequently.
Assalamualaikum warahmatullahi wabarakatuh. My name is FATIN SHAHIRA binti ABDUL SHAARI. I would like to present about diet modification for patient with ostomy bag. Firstly, for bulky stools, it both soluble and insoluble fiber. For soluble fibers such as oats, apple, carrots, bananas, sweet potatoes, peas, beans, and lentils that can soften the stools by absorbing water. Next, for insoluble fibers such as vegetables like spinach, broccoli, cauliflower, seeds, and nuts that can add bulk to stool. Then, increase fiber gradually to avoid gas and bloating. Last, introduce high fiber food slowly to help your digestive system adjust. Second point, foods to reduce odor. Firstly, probiotic such as yogurt, kefir, kimchi, sauerkraut, and miso help balance gut bacteria and reduce odor. Second, parsley acts as a natural deodorizer for the body. Activated charcoal can absorb gases and reduce odor that used under medical advice. Last, baking soda that helps neutralize odors when consumed in a small amounts. Cruciferous vegetables such as broccoli, cabbage, cauliflower, brinjal, and sprouts. Legumes like beans and lentils, peas also need to avoid and limit for intake. Carbonate drinks such as soda and sparkling water, spicy foods and garlic, and last, dairy milk and cheese if you are lactose intolerant. Then, fluid intake, drink enough water to prevent constipation and improve digestion. Aim about 8 cups of water a day or more if needed. For avoiding constipation, increase dietary fiber gradually and balance with enough fluids to prevent constipation. Prune juice or warm liquid such as herbal teas may promote regular bowel movement and reduce the risk of constipation. And then, for managing gas, avoid gas-producing foods such as onions, beans, and certain vegetables. Small, frequent meals, this help reduce the pressure on the digestive system and minimize the gas buildup. Last, chewing food thoroughly that reduce air swallowing and can help prevent gas. Next, for nutritional consideration, first, protein. Include lean meats, eggs, tofu, and legumes to meet protein needs. Next, healthy fats. Incorporate sources of healthy fats like olive oil, avocado, and nuts for energy and essential fatty acids. Vitamins and minerals ensure adequate and intake of vitamins A, C, D, and calcium, also iron, as absorption might be affected after post-surgery. Consider supplement if needed under the guidance of a healthcare provider. Next, special supplement for ostoma patient. For probiotic may help balance the gut microbiome, reducing the risk of infections and bloating. For ostomy specific supplement, some patients benefit from product designed to support ostomy health. Last slide, for sample meal plan that I suggested for ostomy patient. For breakfast, rice porridge with sliced banana and sprinkle of chia seeds, a glass of warm water or herbal tea like ginger tea. For lunch, grilled chicken with steamed pumpkin and white rice, a small serving of cucumber salad. For peeled and lightly salted. And then for snack, a handful of roasted almonds or a small bowl of plain yogurt. And then dinner, grilled fish like tilapia or stingray with mashed sweet potatoes and steamed kangkong. Then, for drink, water or herbal teas throughout the day. This plan includes simple, easy to digest Malaysian dishes that are gentle on the stomach while providing essential nutrients. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is NABILA binti JAAFAR. My metric number is 076459. Today, I will present about health education on ostomy bag. For the lifestyle modification, it contains activity daily living or ADL. In ADL, it contains physical activities, clothing, travel, and work and professional. After surgery, it is important to take care of patient body, especially if the patient have an ostomy pouch. Encourage patient to do light activities such as gentle exercise like walking, yoga or swimming can help improve patient fitness, reduce stress and support your recovery without putting too much pressure on your stomach. Next, avoid intense activities such as stay away from heavy lifting, contact sport like football or hard abdominal exercise right after surgery. These activities can cause discomfort or problem like leaking. Lastly, patients need to wear support such as use an ostomy belt or support garment when exercising. This helps keep patient pouch in place and prevent leaking or discomfort. Other than that, is to feel comfortable and confident with your ostomy pouch. Encourage patients to wear loose-fitting or high-waisted clothes. This outfit helps cover and support the pouch without putting pressure on the stomach. Next, avoid tight or restrictive clothing as they can press on the stomach or pouch, causing discomfort, skin irritation, or even damage to the stomach. Encourage patients to choose clothes that let them move freely and feel at ease. Next, when traveling, encourage patients to pack extra supplies like pouch, barriers, and wipes in patient carry-on or luggage so patient ready for any delays or emergency. This helps patients to avoid stress or discomfort if unexpected pouch issue happen. Also, know where restrooms are located to stay prepared. Last but not least, at work, encourage the patient supervisor know privately if patient need adjustment, like easier restroom access or flexible break. This creates a supportive environment and help patient to work comfortably. If patient job involved in heavy physical activities, hiding patient condition can make things unsafe or more stressful. So, it is better to address the patient needs openly.
Assalamualaikum. My name is HADFINA binti AZMI. My number matric is 077154. Today, I want to talk about activity daily living with an ostomy bag in aspect sexuality and social life. These challenges can feel overwhelming, but with the right approach, patient can still live a happy and fulfilling life. Let's look at how patient can handle this situation with confidence and ease. Having an ostomy bag doesn't mean your intimate life is over. It's all about building confidence and being open with your partner. Take time to feel good about yourself. Wearing special wrap or clothing can help you feel more comfortable. Talk to your partner about your feelings and work together to find what feels good for both of you. Small preparation like emptying the pouch before intimate moments can make a big difference. Remember, intimacy is still possible. It just needs to adapt. And also, living with an ostomy bag doesn't mean you have to avoid social activities. You can still go out, meet people, and enjoy life. Good hygiene and taking care of your pouch will help you feel more confident. Talk with friends or join support group if you need someone to share your experience with. When going out, carry extra supplies so you are always prepared. Don't let fear hold you back. Just enjoy activity like traveling, sports, and dining out. With a little planning, you can manage any situation.
Assalamualaikum warahmatullahi wabarakatuh. My name is AMIRA and I will be explaining for the next part, which is lifestyle modification in spiritual. Firstly, for wudu, patients with ostomy should be advised to clean the ostomy area as best as possible, replace or clean the bag, and then perform wudu just before each prayer. This wudu remains valid even if the bag discharges during the prayer. Also, if cleaning the area or performing wudu with water can cause hardship or harm, they can perform tayammum as a substitute. Next, for prayer, patients should be reminded that the ostomy bag should always be covered with clean materials. This is to ensure modesty and help maintain cleanliness during the prayer. It is also important to explain to the patient that continuous discharge from an ostomy bag falls under the category of chronic excuses. Therefore, they can focus on praying without concerning about the discharge. Next, they should also pray in the usual manner as their condition is not a barrier in fulfilling this obligation. And lastly, for fasting, we need to explain to the patient that patients with medical conditions are exempt from fasting during Ramadan and they can compensate it later through fasting or fidyah.
Assalamualaikum warahmatullahi wabarakatuh. My name is AZRIENA binti AZALI. So for emotional support to the ostomy patients, we need to encourage the family members to listen feelings of the patients without any judgment, and we also need to show our care to the patients and always give positive vibes and positive words to them. Also, we need to give them privacy when they need it. We can offer help with solidaritas without taking their independence, and as a family, we need to let them adapt emotionally and physically. And lastly, as a family, the thing that we can do is always remind them that they are loved and valued no matter any changes that happens. As a friend, we need to also invite them to social activities to keep them connected so that they are not feeling neglected. And as a friend, we need to treat them as before. Do not treat them different before and after they sick, because they can feel worried and more emotional about it, and also be understanding towards them. As in community, we can create support groups where they can meet others with similar experience so that they can feel better that they are not the only one who use the stoma bag. And in community, we need to reduce stigma and also be understanding by spread awareness to community that it is normal to see people with stoma bag and do not see them different with other people.
Assalamualaikum. My name is SAMIHA binti SOBOHI. My metric number is 076525 and I will presenting about financial support. Why a financial support is needed? First, high cost of supplies, which ostomy supplies like pouches and adhesive are expensive and need regular replacement. Second, limited income. Some patients are struggle to afford supplies due to low income or inability to work. Third, additional healthcare costs. Additional expenses for doctor visits, surgeries, or hospital stay add to the burden. Fourth, emotional and psychological stress. Financial and physical challenge of ostomy care can lead to stress, which making support essential. Here are some options of financial support. First, health insurance coverage. Health insurance coverage only for those who bought insurance before diagnosis. It covers ostomy supplies like pouches and wafers. By the way, patients must check their policy for details. Second, non-profit organizations like Ostomy Association of Malaysia give free or discounted supplies. It also provides emotional and practical support. Patient can contact OMM for help. Next, government assistance program like Jabatan Kebajikan Masyarakat offer financial aid, especially for low income or disabled individual. It requires income proof and medical reports to apply. Lastly, zakat or religious aid. For Muslim patients can apply for zakat from religious councils. It helps to cover healthcare costs like ostomy supplies, but it needs documents like doctor's letter and income proof.